Good morning. It's 5:30. Getting ready to head to Piedmont Hospital again for another procedure to find out why for the past 2.5 months, almost 3 months, I wake up in the middle of the night vomiting and diarrhea for no reason. I just get sick and go run into the restroom and hug in the toilet. So today, me and my mother is getting ready to head to Piedmont Hospital to check in. So, wish me luck. When I found out I had lupus, it was 6 months after the birth of my son. It started in my hands. I almost dropped him when he was a baby because my hands just locked up and they were so painful and I didn't know what was going on. So I called my OBGYN and she referred me to a rheumatologist at Cobb Hospital at the time. And I went in and he did some lab work and he said it was going to take 2 weeks for it to come back. And 2 weeks, I'm still, it was just that one episode, so I didn't really think too much of it. Maybe it's nothing. So I went on work and doing my regular thing, hanging out with my girlfriends. Then I get a phone call 2 weeks later from the nurse. She said to come in and bring someone with you. And I'm like, bring someone with me? I'm like, uh-oh, this can't be good. So 2 days later, me and my mom actually went, and we waited patiently out in the waiting room, and he came out and walked us back to his office, and he had my file in his hand, and he was like, I remember the day like it was yesterday. He sat down behind the desk, introduced himself to my mom, and he was like, I don't know a good way of telling you this, but you have mixed connective tissue disease, and one of them is lupus.
That was my first time of hearing anything about lupus. Like you say, we hear about cancer, heart disease, and diabetes, but lupus, I never heard of it.
What? What is lupus? It's like, wow, what is that? Never heard of it. I didn't really think nothing of it. Lupus, okay, she'll be fine. But I didn't know the severity of it.
We like, okay. And I'm thinking I'm just going to get some antibiotics and get rid of it until he explained what lupus was.
The doctor said that it was incurable.
And I remember, I'm sorry, I remember sinking down into the seat because I felt like he just handed me my death sentence. And I'm like, oh my God, what am I going to do? I just had a baby, and you telling me I'm going to die, pretty much.
And it was kind of hit us like, okay, what we do now, and what you're going to go through. But, we had no idea where the road was going to lead us after finding out, the lupus, of her being sick, and just the nervousness, took place during those times. It was just really hard.
I fell into a depression for about a month. I wouldn't speak to anyone, wouldn't leave my room.
I always used to tell Tamika, think about Jalen, your son. You got to keep pushing because of him. Don't you want to see him grow up to become that man you want him to become?
Well, it was rough. It was rough. And, she, questioned God, just questioned a lot of things, like, why me? What's going on with me? Why are these things happening to me? Why am I enduring this level of pain, this level of agony?
My mom had to take care of Jalen, and it took a lot of praying to bring me out of it. It's May 21st, Tuesday at 4:15 a.m. I'm still undergoing chemotherapy. These past 2 weeks has been very hard. I wasn't expecting a one-night trip to the ER to turn into all of this, but it did. Lupus is very unpredictable, and you just gotta roll with the punches. Hopefully today or tomorrow will be my last day in here, but I still will have to continue the chemo. Right now, I'm starting to feel the effects of it, but I'm thankful I slept through most of it.
It's gradually gotten worse. It definitely has gradually gotten worse because the disease, it's a immune deficiency disease. So the disease pretty much has attacked the immune system, and her body it's just kind of deteriorated her body. So yeah, gradually. So at first it might have started with, pain, or, some skin lesions, or some things like that. And then the next thing you know, it's attacking her kidneys. And then the next thing you know, it's attacking her liver. Like 2 or 3 years ago, we didn't know if she was going to live because she had cirrhosis of the liver. And we were like, what? And I just remember being like, oh my God. And then, then she had to have dialysis. And I'm like, I thought that was only for people but it's attacked her liver. And so it's definitely, and the bones, her bones are always aching and she's always in pain. So then she has rheumatoid arthritis. And I'm like, my grandmother has that. You're too young to have that. So when I tell you every organ in the body, skin, muscle, organs, feet, bones, it has attacked. To the point, even teeth, like her teeth are getting weak and falling out, and hair falling out, and it's like, oh my goodness. And a lot of people have no idea or no clue that this disease even exists, yet let alone the effect that it has.
3 to 4 months later, it hit me hard. My mom, it was in the middle of the night. My mom, I screamed out. I was just in agonizing pain, and she was like, what to do, running around my room.
It had to end up calling, EMS, because when she's in a situation like that, she's untouchable. I mean, if you touch her, it hurts to the touch. I mean, just to even do like, she's screaming out, crying out.
It was actually some firemen that came first before the EMS came, and they didn't know what to do because I wouldn't let anyone touch me. I just screamed and screamed for help, but didn't want anyone to touch me. So when the ambulance came and they knew what lupus was, and they was like, we're sorry, sweetie, but we're going to have to put this blood pressure cuff on you, and you know how that just, oh my God, just made it worse.
After that, things just started to happen, like smaller things, and they just got progressively worse. Like, I just remember being there when she had her first seizure, and here I am, like this 20-year-old girl, and she's in the bed just like having this seizure, and no one else was there. And it's like, oh God, not knowing what to do or how to handle that. Like, why are you having a seizure? Where is this coming from?
And all she said was, Mama, I don't feel good. And she fainted, and she started hemorrhaging. We rushed her to the emergency room, and they had to give her blood transfusion because she was hemorrhaging just that much.
When I was living in Miami, it was after hours, after the office was closed. My husband was at work. I was at home with his parents, and I was having a little trouble breathing. And I thought maybe it was just from allergies. I just needed to get, get on the nebulizer machine, but I didn't have one with me. So his dad took me to the hospital, and I'm just thinking I'm just going to go in, get a breathing treatment, and go back home. But all these former doctors came in the room because they did chest x-rays. They, you know, when you're having trouble breathing, they naturally going to do a chest x-ray. And they was like asking me all these questions. Have you had a fever? How do you feel? I'm like, I feel fine. And they was like, you're not in no distress or anything? No. They was like, we can't let you go home. You have double pneumonia. Both your lungs are filled with pneumonia. So they put me in this glass room. I had to be isolated, and no one could come in without a mask and the gown. Or my body didn't give off any sign that I was that sick.
At the time, I was still in college, and I just came home, maybe for the summertime or something like that, and she was upstairs in the room, and she was, you know, bathing Jalen, her son, in the bathroom. It was like 1 minute she was fine, and then the next minute, you know, I hear screaming, just pain, and she went into the room and just laid in the bed, and you could not touch her. You couldn't. I mean, I don't know what was going on, and of course, in the inside, but I guess it was, you know, like you said, it was flaring up. But I can just tell she was just in excruciating pain, very intense pain, and it just caught me off guard because, you know, you can't do nothing. You know, all you can do is just sit there and, you know, and watch and listen.
As a son, to watch your mom just go through that on a daily basis, being in pain and not being how she used to be, and just seeing her cry, it just hurts you. Well, it hurts me. And I'm her son, and you don't want to see that from your mom, just crying and in pain.
You're there and you can't do nothing, and that person really requires that you do something, be there. That's a hurtful feeling. That's like a mother that's child is crying out for milk, but is barren and can't give him milk. She's hurt. She's like, what do I do? You know, and it's no answer for it.
From a mother's point of view, you just feel helpless that your child is going through that, and you want to carry that burden for her and take the pain away from her and put it on your own self. But I know I couldn't do that. This is something that Tamika have to go through.